Have you ever wondered what the relationship between arts and health is? I totally have. This has been the basis for my PhD research. And what I found is that the arts can actually help to promote, improve, and maintain health. There has been a parliamentary inquiry on this, and what they found was that the arts can help to keep us well, aid recovery, and support longer lives, better lived. And I think in terms of mental well-being, the arts can do so much for us. When we're talking about arts and mental health, it can be a bit confusing because what is mental health? So mental health is kind of like the overarching term. And within mental health, we have mental well-being and we have mental ill health. And what's really interesting about that is that a person can actually experience both of these things at the same time. So say you might be an anxious person, but then you might do an arts course. And in that moment, you might actually experience mental well-being. You might experience happiness. So in terms of like levels, they may change. And that's what's really important about the arts, because any person can experience mental well-being, mental ill health. But what's really great about the arts, in terms of that shift towards mental well-being, we are actually able to empower ourselves to do things so that we are improving our mental health or maintaining our mental health or promoting mental health for ourselves. Now, this is very much about what you enjoy doing. So if you like singing, you should sing. If you like painting, you should paint. If you like drawing, draw. This isn't about one art form being better than another art form. It's about personal preference. It's about empowering you to have an extra option when it comes to your mental health. And so it's about doing the art that makes you feel good. So super exciting. As part of my PhD, we have actually quantified the arts dose. So first of all, what we did was we actually found a link between engaging in the arts and mental well-being. But then also what we found was that there was this threshold amount. So people who engaged in 2 or more hours of arts per week actually had better mental well-being than people who engaged for lower levels or who didn't engage in the arts at all. And this was after controlling for a range of confounders and effect modifiers. So these are things like, say, income, age, whether or not you're married, whether or not you have children, whether you play sport, religious activities, have you been on a holiday? We controlled for a range of things. And even after that, statistically, we still found a link between arts and mental well-being and also a threshold at 2 hours per week. So good arts, good mental health is no pressure. This is about fun and enjoyment and having a go. So, if you don't get your 2 hours per week, it's okay. It's a suggestion. It's about information. It's about empowering you. Aim for doing the art that makes you feel good. Try for 2 hours per week for good mental health. Because good arts, good mental health.